This video is about OET speaking test. Welcome to our channel. If you're preparing for the OET speaking test, then trust me, you're really going to love today's video. We are going to go through exactly how to handle OET role plays, how to sound confident and natural, and how to use clinical communication the way examiners expect you to. And guess what? I have also prepared new examples for optometry and dentistry. So grab a notebook, sit back, and let's get into it. All right, let's start with the basics first. In your OET speaking, you do two role plays. Each one lasts around 5 minutes, right? You'll play the healthcare professional, that might be a nurse, doctor, dentist, optometrist, pharmacist, whoever your profession is. And the examiner plays the patient or colleague. And your goal is simple here. You need to communicate clearly, calmly, professionally, and with empathy. That's it. You don't need fancy English, you don't need medical lectures. You just need to sound like a real healthcare worker talking to a real person. So, what exactly do examiners judge you on? There are three language skills and one major communication skill. The first one is pronunciation. Don't worry about your accent. Just speak clearly enough so the examiner does not struggle to understand you. And number two is fluency. You have to keep your pace steady. Don't rush, don't freeze. Natural, calm speaking. That's the way they want. And number three, of course, grammar and vocabulary. Try to keep it simple and with correct yet professional sentences. You can use professional medical words only when required, and you can explain them in a very simple way. And then comes the big one, clinical communication. That means empathy, reassurance, asking questions, checking for understanding, and giving explanations what patients can follow. Okay? Now, let me introduce a scenario. You are an optometrist speaking to a parent. Their 8-year-old son has been having trouble seeing the board at school. You have finished the eye exam and the child has moderate myopia. Now, it's your turn to start your speaking task. Let me start now. Okay, thanks for waiting, Miss Lee. I have had a look at your son's eye test results and I would like to explain everything to you in a simple way. So, the main thing we found is that he has moderate myopia, which basically means he can see things up close quite well, but anything far away, like the classroom board, becomes a bit blurry. It's a very common condition, and many children develop it around this age, so please don't worry. Now, the good news is that it's very easy to correct. I would recommend a pair of lightweight glasses for him. This will help him see clearly in school and reduce the squinting and eye strain he has been experiencing. I also want to reassure you myopia is manageable. We will monitor his vision regularly, and if there are any changes, we can update his prescription. How are you feeling about this so far? Do you have any concerns about him wearing glasses or the diagnosis? I'm happy to explain anything again if you would like. Now, let me tell you why this response gets you a higher score. The first and foremost thing here is the clinical communication criteria. I have started with polite acknowledgement. Thanks for waiting. I have given a clear, simple explanation of the diagnosis. I have also provided the reassurance. I have used phrases such as don't worry, easy to correct, isn't it? And I have shown empathy by asking, how are you feeling about this so far? And I have invited questions, which is very, very essential for OET scoring. And when it comes to my pronunciation, I did not use any complex words except the term myopia, which I have explained immediately, right? And I have used very short, manageable sentences, which would be easy for the examiner to understand. And the fluency, yes, there was a smooth flow, no sudden topic jumps, And if you see the structure, I have started with my findings, then I have given explanation of the same, and then with the reassurance, finally the plan and the concerns. And here comes grammar and vocabulary. I have used appropriate medical vocabulary, but I kept the overall language simple. Got it? And have you also used conditional forms like I would recommend, so which can sound professional and polite. Now let me move on to another scenario. So this one is a dentistry scenario. You are a dentist. A patient has been experiencing sharp pain when eating sweets. The exam shows an early cavity. So now, when you're ready, you can also start. Let me start my speaking test. All right, Mr. Carter, thanks for telling me everything earlier. I have had a look at your tooth and I want to explain what's going on. So, the pain you're feeling, especially when you eat something sweet, is happening because there is an early cavity forming in that tooth. And the good news is that we have caught it early and it's very easy to treat. What we will do is we can place a small filling to stop the decay from getting worse. The procedure is quick and I'll make sure you're completely comfortable the whole time. I know a lot of people get nervous about dental work, so please feel free to let me know if you need a break or if you're feeling anxious. I will guide you through every step. And after the filling, you should notice the pain disappearing within a day or two. How does that sound to you? Is there anything you would like me to explain again, or do you have any concerns about the treatment? Okay, so why this response gives you a high score? First and foremost, this response is a patient centered communication. It begins by acknowledging the patient's symptoms. It explains the diagnosis in a very simple, patient friendly terms and also reassures the patient multiple times. It shows empathy toward dental anxiety. Examiners love this. And it actively checks for understanding and feelings, right? If you look for the pronunciation, it is very clear and natural, no overcomplication, right? And explanation of the cavity is very simple and gentle. The fluency is very strong because there was a steady pace, natural flow, no abrupt changes. Smooth transition from diagnosis to treatment to reassurance and then next steps. We have used here suitable dentistry terms such as cavity, filling, decay. Got it? And also balanced medical vocabulary with simple language. Okay. If you have noticed something in both role plays, I did not use complicated English. I did not rush. I did not talk like a textbook. I simply explained the condition in a plain language. I have reassured the patient. I have checked their feelings. I have invited questions. And I also structured the conversation clearly. So, this is what exactly OET examiners love. Okay? Let me tell you the biggest mistakes the candidates make: talking too fast, using too much medical jargon, giving long explanation without checking understanding, showing no empathy, and sounding robotic or memorized. Try to avoid those, and you're already above average. Okay? And that's everything for today. I hope this spoken style practice helped you boost your confidence. If you want more role plays in other fields like nursing, pharmacy, physiotherapy, or medicine, just drop a comment below. Kindly like, share, and subscribe for more OET tips. See you in the next video. Bye bye.